It is very likely that you have or will experience an episode of low back pain in your life. It is also very likely that you'll experience another episode of low back pain at some point in the future. But the good news is that most cases of low back pain will go away within a couple of months. A small percentage of the population, around 5% or so, will continue to experience chronic low back pain symptoms that last for 3 months or longer. And even in these cases, it is rarely associated with serious injury, no matter how severe it may feel. Yet, despite the advances that our society has made over the years, from landing rovers on Mars, discovering the Higgs boson particle, to creating some of the best cinema in human history, we continue to suck at treating low back pain. In this video, we will discuss why this is the case and what providers and patients can do about it. Let's kick this video off by appreciating just how out of step our healthcare system is with established clinical guidelines and best evidence for managing back pain. While our evidence is doing the tango, our healthcare system is doing whatever the hell this is. Unlike common medical conditions that can be diagnosed utilizing medical technology, the large majority of low back pain is what is termed nonspecific in nature, meaning it cannot be confidently attributed to any specific cause in about 95% of cases. This means that commonly utilized diagnostic tests, such as X-rays and MRIs, have very little clinical use when it comes to managing low back pain, due to the poor correlation between structural changes seen on imaging and the patient's symptoms. So patients with this type of nonspecific low back pain should not receive imaging. But these guidelines are often tossed into the trash, with patients commonly receiving unnecessary tests, which result in them being labeled with diagnoses such as degenerative discs, spinal stenosis, and arthritis. Diagnoses that sound super medical and concerning, but are just normal age-related changes. It's equivalent to your low back pain being attributed to your receding hairline. But patients often don't know this, and providers tend to leave this crucial bit of information out, and in doing so can impact the health and well-being of patients. Because just being labeled with these diagnoses has been shown to have negative psychological effects, with patients rating themselves lower in terms of health and wellness compared to those who were not told of the imaging findings. Patients have also been shown to be more fearful of movement and activity, which can increase their risk of developing chronic low back pain, all because of an image with some signs of likely normal age-related changes. Incredibly, research has also shown a 2 to 3-fold increased risk of receiving surgery in those with nonspecific low back pain who receive an MRI earlier in their course of care. Yes, that's right. Despite a lack of correlation between structural changes seen on MRI, surgical decisions are being made to fix these structural changes. And these rates have been skyrocketing. The number of elective lumbar fusions for degenerative spine disease increased 276% in the USA in just 12 years. Yet the available evidence does not support spine fusion over non-operative alternatives for nonspecific low back pain associated with spinal degeneration, such as arthritis, lumbar stenosis, or degenerative discs. Because not only do these structural changes likely have nothing to do with the patient's back pain, these surgeries have serious risks that are just as likely to lead to more pain and disability. And when considering any type of surgery, confidence about the outcome should be Tom Brady's Super Bowl game level confidence, not Buster Bluth level confidence. Surgery for nonspecific low back pain is a misguided attempt to treat the symptoms of low back pain without a clear cause. Another entry on this list of low back pain bloopers is how little physicians are referring to physical therapy. You see, research shows significant cost savings when referrals to physical therapy occur earlier in the care process for patients with acute low back pain symptoms, particularly if the physical therapy focuses on active treatment approaches. Total low back pain related costs during 2-year follow-up for the patients receiving early guideline adherent physical therapy were on average $1,200 lower compared to patients receiving delayed physical therapy. Patients also received less risky treatments, such as being prescribed opioids, receiving spinal injections, or undergoing surgery. They also required less clinical visits compared to those who received treatment that did not follow established guidelines, which resulted in prolonged recovery and increased medical expenses. But despite physical therapists being considered the first-line provider for low back pain, the national referral rates are estimated to be only 7 to 20%. And over the past decade, we have seen the referral rate drop, while the rate of specialist physician referrals increase significantly. And patients can often be left waiting weeks to months to be referred to physical therapy for reasons ranging from the time it takes to see their physician, to physicians utilizing a wait and see approach, or the patient being referred straight to the surgeon. This is the exact opposite of established practice guidelines, which suggest the need for active, non-medical treatment approaches provided by non-physician providers. Physical therapists have the skills and expertise to manage these patients, yet they are being kept on the bench when they should be batting leadoff. Put me in, coach! To recap, nonspecific low back pain has been and continues to be a notoriously mismanaged condition. Despite evidence and established practice guidelines, we continue to prescribe costly and often unnecessary medical tests and treatments that can have significant risks to our patients and are focused on finding and fixing structural problems that have been shown to have poor correlation to the patient's symptoms. There has been a glaring underutilization of physical therapy over the years, despite proving to be a safer and more cost-effective treatment approach. When it comes down to it, physical therapists are in the perfect position to provide first-line treatment, as they are extensively trained in how to manage low back pain and have been shown to reduce the likelihood of patients receiving unnecessary imaging and more risky treatments, such as surgery or injections. Just remember, most low back injuries feel serious, but the bark is often much worse than its bite. Hardly ever is low back pain a serious medical condition, and it often will resolve completely. And even in cases of chronic low back pain, symptoms are often not a reflection of tissue injury or damage. So get out there and move, or at least call your physical therapist who will show you how. Thanks for watching another episode of Physio Show. Make sure you like and subscribe to the channel to receive more physical therapy related content.